I, Dr. Ramkumar Srivastav, will give you some silent features of heart attack. Heart attack, which is also known as myocardial infarction, the person might only find out through a routine ECG weeks, months, or even years later. This is a picture of chest pain in the heart attack. This is also the picture of pain in the heart. This picture gives the normal appearance of picture of heartbeat in ECG. In ECG, this picture will give the difference between the normal one and the myocardial infarction or the heart attack. In myocardial infarction or the heart attack, the ST level, you can see there is a S and T levels which is elevated in ECG. This is shown in the picture. So by this finding you can assess that this is a case of myocardial infarction or heart attack. These are the some 21 icons of heart attack. What are the clinical features which are present in heart attack? Mild chest pressure, not sharp pain, but a heavy or tight feeling in the chest, like something pressing down. Shortness of breath, even during light activity or at rest. Dizziness or light headedness. Unusual fatigue, which is a silent feature in the heart attack. It is a deep, ongoing exhaustion that doesn't go away even after a good night's sleep or proper rest. So, if you are finding the fatigue even after the good sleep or proper rest, then you can assess this is a case of heart attack. Cold sweats, sweating without any reason like exercise or heat. Sleep problems, trouble falling asleep or walking up tired. Pain in the jaw, neck, back or arms, especially on the left side. Sometimes mistaken for a pulled muscle. Indigestion or nausea, so this is a very confusion. Sometimes you can also feel indigestion or nausea because of the chest pain. Stomach discomfort that feels like acidity or gas. So sometimes there is a confusion whether this is indigestion or this is a pain due to the heart attack. Take this kind of fatigue seriously. It is easy to blame it on poor sleep, work, or minor illness. It feels like everyday tiredness or stress. There is no sharp pain or dramatic symptom. It can last for days or weeks, making it seem normal. What is the unusual fatigue, which is a silent feature in the heart attack? It is a deep, ongoing exhaustion that doesn't go away even after a good night's sleep or proper rest. This happens because your heart may not be pumping blood properly due to reduced blood flow with less oxygen reaching your muscles and organs. You feel constantly drained even while doing normal activities or sitting still. You might also notice mild breathlessness or feel wiped out after doing something simple. If silent heart attacks are missed, the damage quietly builds up. This can lead to higher chance of a second heart attack, more severe, and the second one is the irregular heartbeats, arrhythmia, and even sudden cardiac arrest. Increased risk of a stroke, weakening of the heart, formation of scar tissue, poor heart function, and heart failure. Heart attack. The risk is higher for these conditions. Those with high blood pressure or high cholesterol level can have a risk of heart attack. People with diabetes as nerve damage can mask pain. A smoker, especially the cigarette smoker or people with unhealthy lifestyles, older adults, women whose symptoms are often milder or mistaken for stress and anxiety. People with family history of heart problems. What are the protection which you have to take for the heart attack? Know your risk factors: diabetes, high blood pressure, smoking, etc. Follow a healthy lifestyle, balanced meals, regular exercise, avoid smoking. Don't ignore unusual tiredness or other subtle signs. Control medical conditions with proper treatment and monitoring. Get regular health checkups, especially if you are at a higher risk. If you feel tired for no clear reason, see a doctor early. Adopting a healthy lifestyle, managing existing health conditions and seeking professional guidance, maintaining a healthy weight, eating a heart healthy diet, engaging in regular physical activity, managing stress and not smoking. What are the prevention which you have to take in the heart attack? Get moving. Aim for at least 30 to 60 minutes of activity daily. Don't smoke or use tobacco. Eat a heart healthy diet, and these are the some of the things which you have to take for prevention of the heart attack: vegetables and fruits, beans or other legumes, lean meats and fish, low fat or fat free dairy foods, whole grains, healthy fats such as olive oil and avocado. Maintain a healthy weight. Waist circumference can measure how much belly fat you have. The risk of heart disease is higher if the waist measurement is greater than 40 inches, that is 101.6 centimeter for men, and 35 inches, 88.9 centimeter for women. get quality sleep. People who don't have good sleep have a higher risk of obesity, high blood pressure, heart attack, diabetes, and depression. Manage stress. Mental health conditions such as anxiety and depression should be avoided. Get regular health screening test, blood pressure, cholesterol level, type 2 diabetes screening. High blood pressure and high cholesterol can damage the heart and blood vessel. Take steps to prevent infection such as COVID-19. Certain infections may lead to heart diseases. For example, gum disease may have a risk factor for heart and blood vessel diseases. So brush and clean teeth daily, regular dental checkups. Yearly flu vaccine and vaccine to protect against tetanus and diphtheria. What you have to take less in the diet: salt or high sodium meals, sugar or sweetened beverages, high refined carbohydrates, alcohol, high processed food such as processed meats, saturated fat which is found in red meat, full fat dairy products, palm oil and coconut oil, trans fat which is found in some fried, fast food, chips and baked food. This is all about the silent features which is present in the heart attack and which is not giving any features in the body, and this may result into risk for the heart attack. Thanks.